Good evening everyone. Welcome to Unacademy, the one-stop destination for the civil services English medium aspirants. Welcome to an initiative called Ethics Simplified. We meet every single week and we discuss underlying ethical issues associated with current developments. This topic that we are going to be discussing today is medical ethics. Now, medical ethics has been in the news for various reasons. Whether there are issues associated with clinical trials, whether there are certain faulty formulations leading to death of innocent children, for example cough syrups, whether there are malpractices in hospitals that need to be curbed or regulated. It is often in the news almost throughout the year. UPSC's focus is also changing towards these applied ethics sections, and they are basically trying to test your knowledge not just on bookish ethical definitions, but on how ethics plays itself in real life situations. So let's dive into the topic, but before that, an important announcement. We have launched an initiative called Unacademy Platinum. It probably will change the way you study. What are the features of Unacademy Platinum? We are trying to get the best of both worlds. The affordability associated with online model, that means the ease with which you can study from the comfort of your home, and you do not require to shift to offline classes. But the best features of offline classes as well. How? We allow you to be present with your camera on, and whenever we ask you questions, the brainstorming session is done by nudging you to switch on your mic and participate in answering in the class. You can always stop the teachers after the topic is over, and a constant doubt resolution session can also be done without the need of typing your doubts and them being resolved much later. Therefore, make sure that you look at the free classes that we have also provided, in which you can at least experience the platinum model. In case you need that little discipline, you need us to make sure that we are following, looking at your faces and understanding if you're following or not. If you need that, then probably platinum is the offering for you. Let's move on now to the topic and discuss why this topic is relevant. As we always do with our ethics sessions, the best relevance for a topic can be mapped by the idea that has it ever been asked in any form related in a previous year question. This has been the case. For example, a case study involving, I'm not reading the case study specifically because I just want to tell you the relevance associated with this. They have directly mentioned the term medical ethics written here. So even if they do not ask in the case study form, which has already been done in 2024, they can yet ask a question which is theory based directly on medical ethics. In fact, in 2024, another question remotely similar to this, associated with a person working in a pharmaceutical company, and therefore he taking a decision of disclosing information relating to a clinical trial or not, was also asked in 2024. Which basically says these sections are very important and emerging. That is the only relevance that you need to know. Now let's understand why is this topic so important and increasing. There are various aspects that we read in the newspapers. Some hospital was booked for the problem of ghost beneficiaries because they wanted to take benefits of the government welfare schemes. They were impaneled hospitals, they were showing ghost beneficiaries. Issues of corruption, issues of morality, issues of medical ethics as well. There are also instances where unfortunately we look at our medical sector with a lot of distrust. That means whenever we as patients go to the hospital, we are all the time very suspicious about the kind or course of action that has been prescribed by the doctors. Because of the various practices or malpractices, as I should call it, that we have seen in the news, we are skeptical whether the hospitals are trying to overcharge us for the stay. whether certain type of procedures are absolutely important or they are just a mechanism for profit motive. There are also instances when certain doctors specifically prescribe only certain drugs of a pharmaceutical company. What is the nexus? Is there a conflict of interest influencing the doctor's decision to prescribe that medicine? We also see when it comes to pharmaceutical companies, the lack of disclosure of information associated with clinical trials. Despite multiple side effects continuing, they are not recalling those medicines from the markets back. The issues associated with balancing innovation and access of medicines to everyone, the evergreening of patents, etc., etc. There are various issues when it comes to the medical sector. So this topic will always be very, very important and relevant from the exam perspective. How do we introduce this? We introduce it by suggesting that yes, the idea of ethics and morality as a relationship or the relationship of trust between a doctor or healthcare provider as well as a patient is very crucial. But it is even more crucial as compared to the other sectors. For example, if you went to buy an iPad probably and there were some issues associated with the features, you probably have some form of replacement guarantee, and that any kind of malfunctioning of a device, for example a technology device, is not really going to have an impact on your life, is not going to have an impact on your health. But the moment some kind of a trust is broken between the healthcare provider and you, and ethics is overshadowed in that relationship, moral consideration, conscience, the intention and the integrity is overshadowed in that relationship, the impact can be very detrimental and that can cost people their lives. So therefore we say ethics is the heartbeat behind every prescription. Every prescription that is prescribed by a doctor, yes, is important, but that prescription should be on proper diagnosis, the integrity of the doctor, the proper good intention and goodwill of the doctor for the patient's interests. So ethics is at the very bottom or the heartbeat behind every prescription. Without it, multiple instances we've seen in current affairs. You will add a current affairs dimension. For example, contaminated drugs and careless approvals can in fact change this sector, turn it from healing to a sector that is creating harm. Harm to not just your pocket in terms of an economic dent, but harm in the form of your health, your life. From toxic cough syrups, and these are clubbed examples that you can provide for introduction, from toxic cough syrups to overpriced stents that you put for coronary heart diseases and unethical clinical trials. Healthcare keeps hitting ethical roadblocks or ethical bottom. That is something that you can introduce with. You've given a current context and you have specified predominantly the importance of ethics in medicine or this field. Now, when we look at medical ethics rests on 4 pillars. 4 pillars or principles define how one should conduct. For example, a healthcare professional or a healthcare establishment should conduct themselves while dealing with patients. The first pillar is about upholding autonomy. What does this mean? This basically means that if it is the person's body, it should be the person's choice. That predominantly means that it is your job and duty to inform the persons about the pros of a surgery, the cons of a surgery, the success rate of a surgery, the alternatives other than a surgery. And after you have provided all this information per se, it is the autonomy of the person. You are enhancing the person's ability to take a decision in sound mind for himself or herself. So the idea is that if it is a person's body, what or which kind of treatment they want to pursue should ultimately be their choice. Your job as a medical provider is to provide them with all the facts, all the details, all the alternatives and all the risks associated. That is the idea of autonomy. For example, patients have the right to make informed decision about their own health. Now, for example, if we had to understand examples, we can say there is a culture and there is a tendency nowadays that a lot of births are associated with cesarean or C-section, and a lot of people are not taking up natural birth processes. If there is a woman who's well informed, who's well read, and who has probably said that she wants to take up the option of natural birth or natural deliveries, in that case, you will give her the autonomy until and unless there are a lot of risks involved in it. If there is a risk involved with natural birth, of course you are going to inform her about the same. But if this is her will initially, you should concede to that will and you should allow her, if everything is provided fine, you should allow her to take that decision related to her body and her birth process. That becomes the first example. The second example is also autonomy of either knowing or being ignorant. For example, now with a lot of genetic studies, with genetic studies, your genes can be analyzed, your gene mapping can be done, and on the basis of that, what you are more prone to, maybe few years later, or you are more accustomed to, maybe a few years later, can be deciphered. For example, if you have a certain gene associated with a risk of breast cancer or not, if you have a certain gene associated with the risk of Alzheimer's or not. Now, it is the autonomy of a person whether he or she wants to go for these genetic testing or not. Some people are very comfortable in knowing, some people do not want to know further. Some people want to know earlier, and maybe if they have that particular gene associated with a predisposition to breast cancer, they get also their breasts removed in order to be a little more cautious. So, depending on the person's autonomy, they can take up this testing or they cannot. You are respecting the first principle of medical ethics, that is autonomy. That becomes the first part of it. Let's understand the other second pillar. The second pillar is beneficence. Now, when we talk about beneficence, it basically says that a healthcare provider must ensure that that person is working for the best interest of the patient. For instance, if there is a patient that comes to a healthcare provider, that healthcare provider is in a rural village where a lot of diagnostic options or proper surgery options are not available. The doctor has recognized that that person has a very complicated case of multi-organ failure, or it is looking like a case where multiple specialists are required and he does not have the support of those specialists. For example, he is maybe just a cardiologist. He needs a specialist associated with kidneys, associated with lungs, etc., etc., as well as gastro. So, he knows that if he takes up the patient's case, despite probably the patient saying that we trust you the most, please treat us, please admit us in your hospital. But the person knows that I have to act in the patient's best interest, not for my profit interest, and therefore have a limited view. Look at it in a short-term perspective. The person should analyze that even if the patient is not with me, but at least he is in the best hands according to his complicated scenario. And that is why in this case, in order to uphold this principle, this doctor will not admit the patient, rather this person is going to refer the patient to a multi-speciality hospital in the district capital, in the district center, or the capital of the state where there are better health facilities. This is what you mean by healthcare providers must act in the patient's best interest. For example, if there are certain times, there are very good cases or there are very good diagnostic tests, but they might take a lot of people because of the amount of money involved, because of the amount of time involved, a lot of people are willing to do this. In that case, doctors are using new technology at least to first scan the people, and if there is any other doubt, for example, AI scans for detecting breast cancer. Even if the traditional methodology is not available or if the traditional methodology is becoming a little obsolete. Surgeons choosing a minimally invasive procedure. For example, whenever you go for surgery, there are various ways in which the surgery can be performed. It can be a surgery associated with the traditional method of maybe opening up a patient, and it can also be a surgery that is laparoscopic in nature. That means minimally invasive. So the doctor must analyze which kind of surgery, and maybe the laparoscopic surgery is not costing so much. It can be a case. But in that case, do not choose the profit or the revenue coming to your hospital, but choose the most minimally invasive procedure that is right and fit for the patient that you are dealing with. That is what we call as beneficence, ensuring that the patient's best interests are upheld at all times. The next is non-maleficence. Now, what is non-maleficence? You are trying to reduce. For example, whenever you are taking up a surgery, a procedure, there can be side effects, there can be pain, there can be other certain external problems. So whatever you have done, whichever the procedure that you have taken, you are trying to minimize the harm that is created on the person. For example, if there are incidents where a cancer patient can be treated using radiation alone, and the chemotherapy can be avoided, because chemotherapy also leads to a lot of weakness for the individual, to the point that it is said that sometimes it is tougher to treat the treatment of cancer or bear the treatment of cancer than cancer itself. So because of the pain associated with chemotherapy, the weakness of the person associated with chemotherapy, a lot of times doctors analyze if a patient is ready or should be given radiation or chemotherapy. Why? Because you are trying to reduce the harm, the pain, the risk or the injury associated with care. Care as well as healing should not be associated with all these as well. There should be a need to minimize this. For example, one of the main aspects that is getting very popular associated with pain management or reducing the amount of pain felt by patients is the idea of palliative care. Palliative care is the idea that even for terminally ill individuals, even for individuals for whom every treatment option is over, at least certain pain management services can be provided. At least certain mental health services can be provided. At least certain end of the life services can be provided. That is the idea of palliative care as well. For example, it is very easy for a doctor to choose CT scan for diagnosis or X-rays for diagnosis or CT scans for diagnosis. But for example, a pediatrician who's dealing with small children, he or she is deciding that if at all my diagnosis can be done using ultrasound, which are not exposing the child to unwanted radiation. If my diagnosis can be using this, then why create a risk of radiation in the future? So the idea to avoid one diagnostic tool which can have an element of risk for the child and preferring a less riskier option, for example, ultrasounds over CT scans, to avoid radiation exposure. That is one example of non-maleficence. The second example is, for instance, if a hospital realizes that there are certain drugs that are coming from a certain pharmaceutical company and those drugs are creating certain side effects. The patients have come back and they have reported certain side effects associated with it. It is not for the hospital to keep their nexus with the pharmaceutical company alive. Rather, it is completely to stop the usage of those drugs if a feedback associated with them has been negative. So, the example where a hospital pauses the use of a newly released weight loss drug, for example Ozempic, after severe side effects associated with it. That is the idea of reducing pain, reducing the risk and reducing the injury. You have to work on these principles and with this aim. The last pillar, the fourth pillar in medical ethics, is associated with justice. Now, justice basically means, or medical justice basically means, that medical assistance to medical assistance should almost be a matter of human right. You should not be denied any kind of healthcare services just because you do not have the purchasing power to afford those services. It should be available to all. These resources should be available to all, and maybe a priority should not only be given to the wealthy, to those individuals that can afford it. This is also health related or medical justice related ideas also on the idea that equity should also be upheld. For example, if you are providing healthcare, those who are the most needy, who are maybe the most high risk individuals, should be provided the first healthcare interventions because of their needs, because of their disadvantage. That is also the idea of justice. You are not treating everyone equally, rather you are upholding the aspects of equity, where if some individuals are more disadvantaged, they will be catered to first. And this preferential treatment will not be a violation of equality, rather it will be an upholding of justice. So, medical justice, the fourth pillar, says healthcare resources, treatment as well as opportunities must be distributed fairly. There must not be inequality associated with wealth, associated with class, associated with region. That means, for example, if the government is starting a program that is called Pradhan Mantri Jan Arogya Yojana or the Ayushman Bharat Mission, the government is trying to uphold justice in medical ethics. Why? The idea to provide healthcare insurance of 5 lakh rupees every year to certain families. Publicly funded healthcare insurance. So this becomes the idea of ensuring that health is delivered to everyone. If you have examples of telemedicine services that are reaching certain villages that are remote, in which there is hardly any healthcare professional, that is also an example of ensuring accessibility associated with justice is delivered. If you are sending certain mobile vans for certain screening or diagnosis, or for example TB diagnosis or TB tests related mobile vans, these are also ensuring that health is accessible to everyone. So this becomes the example associated with justice. Government expanding, for example, ensuring the HPV vaccine is for every individual, irrespective of the wealth they belong to, can access this for cancer prevention, the HPV, human papilloma virus vaccine. Another example is community clinics, for example, prioritizing vaccine appointments for those who are the most high risk individuals. For example, individuals to get the COVID vaccines, those who have certain very serious respiratory diseases and illnesses that are more prone to having complications if at all they incurred or they got the virus. So that is why we say prioritizing appointments for elderly that are more vulnerable, that is why more or better preferential treatment, for disabled sections and for high risk groups first. That is the idea of justice. Now, what you can also quote in the exam, other than of course the principles of medical ethics, are the instances, the examples where medical ethics are violated or the instances where malpractices are witnessed. There are various examples. For example, it can be the contamination of certain formulations, for example cough syrups, where maybe possibly cheaper alternatives have been made, and the usage of these cheaper alternatives in the formulation of drugs, for example cough syrups, can cost people, little children, their lives in certain low income countries. So the example of cough syrup contamination scandal linked to child deaths in Gambia, that becomes the first example. The second example is hospitals performing unnecessary cardiac stent surgeries for profit. You probably did not need it at that time, but a lot of hospitals are performing these surgeries. Why? In order to increase the revenue, in order to just increase the bill associated with it. The doctor and pharmaceutical nexus, doctors providing only those medicines for which they probably get a pushback, for which they probably get an incentive, a cut from the sales of the pharmaceutical companies. Next, forced or uniform sterilization. That means medical malpractices are also associated with instances where the autonomy of the individual is denied. That means in order to ensure population control measures, you are not upholding the rights of individuals. Uninformed sterilizations of marginalized women. The instances of organ trafficking rackets, that are also examples of malpractices, right? So organ trafficking rackets are also examples. The others are that in order to get better insurance or to have better insurance claims, the hospitals keep increasing the bill associated with your stay. A pharmaceutical company, even after knowing that their drug is creating significant side effects, are not pulling out that drug from the market because they do not want to dent their marketing image, or they don't want to dent their profits. So this becomes one of the few malpractices that you are writing about. Now, we can also discuss certain ethical dilemmas in medical ethics. What do you mean by ethical dilemmas? A dilemma is between either two wrong choices, or a dilemma is between choosing two right choices. Nothing is completely wrong, nothing is completely right. There is some good in the first choice versus some good in the second choice. It is the difficulty of choosing which is better. That is where you come in a dilemma related situation. Because if one was right and one was wrong, that would have given you the answer. There would be no confusion. So dilemma is between two competing options. What do you do? Let's look at certain classical medical ethics related dilemmas. The first is autonomy versus beneficence. What does this mean? For example, there is a patient who has probably exhausted every form of treatment in the future. Even today, the patient has no other treatment options left. They are almost entering a vegetative state, a terminally ill state anytime soon, because the doctor is losing out on all the options available. The doctor is trying to work in the beneficence related principle, that you are acting in the best interest of the patient, and you're probably telling the patient that maybe allow me to try for the next 1 month. There is a research that is going on, an innovation that is happening. Maybe there is that one drug that can work in your case. So prolong your suffering. Allow me to work on you for 1 month extra. But that person's autonomy, if the doctor also has to uphold the person's decision, that person is saying, I do not want to wait for any innovation, research, new drug to come. I want to end this suffering soon. I do not intend to make my family members see that condition of mine. So in fact, that person is asking and requesting the doctor for assisted dying, that is euthanasia. So in that case, there is sometimes a conflict for the doctor, Beneficence says that you are acting in the person's best interest. You still have hope in science and medicines, etc. But the idea of upholding the patient's autonomy says it is finally the patient's body, he or she should take the final decision. Next, confidentiality versus public safety. This basically means, yes, that person is your patient. You should uphold the person's privacy. You should not probably disclose the person's medical treatment, history, etc. But what if that person is a carrier for a disease that can create a community outbreak, that can have safety concerns for others? For example, a patient with the HIV status refuses that you should not inform their partner, but you know that that will put the partner at huge risk as well. So on one side it is public safety, the other side it is confidentiality. That is also an ethical dilemma. The next ethical dilemma is again between the patient being a child, that means a minor, who probably does not have the autonomy or probably the right to take a decision for himself or herself. But you know what is right for the child as a medical professional. But the parents are often associated with, the parents are linked to certain superstition, they are linked to certain hesitancy, and they say that we will not, even if our child is critical, we will not allow for a provision of blood transfusion for the child. It is the parents' right to decide for the child. But you are also looking at the child as a separate patient for which you will see in the best possible manner. So will you allow this or this person or this child to die in front of you, even though you know there is a possible option to save him, by upholding the rights of the parents to decide for him? So parents decline a life-saving blood transfusion for their child due to their religious beliefs or their cultural beliefs. What should the doctor do in that case? Next ethical dilemma is truth versus hope. Now, that is also basically important. For example, a doctor has to give exactly and disclose the exact status of a patient to them so that the patient is informed. But the doctor also knows that if I reveal exactly what is going to happen to that person's mental health is already very, very critical and fragile. So at this moment, should I plain simple give him facts, that is truth, or should I offer him some form of hope by concealing the truth and acting in a compassionate form? So truth versus hope is also a problem. The next is research versus vulnerability. That means we need people who volunteer for clinical trials. Because of people volunteering, there will be better research, innovation, and new drugs and formulations can be created. But most of these people who agree for these clinical trials unfortunately come from very low income countries. They say try whatever drugs on us you can. They are willing to have their body be used like a lab, like a case study, just for some amount of money, because that is the amount of helplessness and poverty in low income countries. So therefore, the dilemma for a pharmaceutical company to think that are we really exploiting the vulnerability of low income segments, or is this right? Is this process right for research and development? That is the creation of new drugs that will have an impact of saving maybe millions and millions of lives in the future. So can this exploitation be balanced with this possibility in the future? The next is duty of care versus moral discomfort. Duty of care means every medical professional is associated with, or there is an obligation of providing care, their services for anyone who is suffering from any medical condition. But there is also a moral discomfort. That means you might not be morally inclined as a doctor to what the deeds of your patients are. For example, there is a lot of public outrage There is a terrorist who is being treated, for example, after a gunshot wound. The terrorist is, if he survives, he can give to your law enforcement agencies a lot of information associated with the links of terror. But the public at large outside is absolutely in anger and wants that terrorist dead because of the number of killings that he is responsible for. The doctor itself is also a human being, part of the society. He can also or she can also feel discomfortable or uncomfortable morally, that why should I save this person? This person probably has not done a right thing. Why am I caring for this person? Right? So that kind of a dilemma can also happen. During an outbreak, should limit it. Now this is also a utilitarian dilemma. The utilitarian dilemma basically says that according to justice, you should provide, for example, if there is a viral outbreak, for example, a COVID situation, should we provide vaccinations first to the elderly, first to the maximum risk individuals? But the chances are they might not still survive after that vaccine. Or should we first provide the vaccines to our healthcare workers? If they are healthy, they will be able to cater to so many more people and save so many more lives. So there will be a multiplication of an option or impact if we give the vaccines first to the healthcare workers. This discussion is between the ideas of justice and equity, provide to those that are most needy, versus those that can have the most amount of impact, highest possible impact and highest happiness of the maximum number of people, the idea of utilitarianism. That becomes another ethical dilemma. Now, if we have to give certain suggestions and recommendations of what should be done as a way forward, we will write certain recommendations. For example, we will say that hospitals, in order to take very critical decisions associated with removal of life support, certain innovative surgeries, as well as in certain outbreak conditions, how to manage the hospital, these decisions should be taken by multidisciplinary teams. What are multidisciplinary teams? Teams that are representing every segment of healthcare. Doctors, nurses, management, patients, social workers, etc. A strong ethics committee that is taking various decisions. The second is, we should standardize protocols. Now I understand your doctor probably knows the best and each case is different. Your case is different, someone else's case is different, etc. But there can be some objectivity that we can include in terms of procedure. That if diagnostic reports, for example ECG reports, suggest these many changes, only then a 2D echo related test should be done. If 2D echo related reports suggest these changes, only then an angiography should be performed. So there must be some objectivity associated with protocols, and of course there should be a whistleblower protection. That means in every hospital there should be certain kind of provisions that allow the safety of those individuals that are trying to disclose any kind of malpractices that are happening in the hospitals without the fear of being put at a disadvantage. The doctor should avoid conflict of interest. Conflict of interest means your decision should not be influenced by your profit. You should research on the new drugs in the market, and your decision should not be based on the fact that you get a cut, an incentive for every drug that you are recommending of a pharmaceutical company. The doctor should be trained in emotional intelligence and clear communication, data and diagnosis based decision making process. That means finally on the basis of data, not unnecessary surgeries. Next, for pharmaceutical companies, they are responsible to the people at large as well. If the people are consuming the medicines of pharmaceutical companies, they absolutely have the right to know how safe is that drug formulation. So transparency and data sharing should be the case with these companies as well. They should also take up ethical marketing. That means they should not exploit the situation when there is any form of increase in demand. For example, during COVID-19, there were cases of predatory pricing. Predatory pricing means you're marketing yourself as or you're marketing in a way that you are being a predator. A predator is basically someone who is exploiting the situation, right? Or who's exploiting the weak. So because demand is higher, you have started to increase the prices of medicines. That also becomes the example of unethical marketing. Last but not the least, these individuals or these pharmaceutical companies should also be audited by independent members so as to check no malpractices are happening. We also need citizens to follow certain practices. For example, one of the major reasons why antimicrobial resistance is increasing in the society is because people are not responsible towards their prescription, towards the type of dosage, etc. So people should not take they should not take self-prescribed usage, etc. of antibiotics, and therefore there should also be honest disclosure. For example, you would see that so many times the doctors are working so hard to work on the patient's growth or progress in a case. But this patient is trying to hide the fact that this patient is not given up on smoking cigarettes. That is not honest disclosure from your side. Belief and trust in the intention, there should also be. For example, any kind of healthcare setup is based on a certain trust. We have seen instances where there are various attacks on doctors and healthcare professionals as well. This is not how citizens can also behave in a civic sense. We also must have feedback loops. For example, have you seen online platforms? For example, Practo, etc., where different doctors have been given certain ratings by their patients. So that ratings also enhance the informed choice of other patients as well. Government and regulations, that means the government needs to have proper reporting standards, must regulate according to NAB accreditation to ensure that all hospitals are following certain standards, certain patient care practices, certain number of healthcare professionals, the management of biomedical waste, etc. The National Pharmaceutical Pricing Authority, in order to ensure justice, had also capped recently, for example, the price of certain stents, the price of certain medical devices, in order to ensure affordability. Last but not the least, we have also made changes in regulation of medical studies and regulation. We have changed and we have introduced National Medical Commission as compared to the Medical Commission of India. So these have also been the examples and the way forward. Last but not the least, you can conclude by saying that it is not only the new technologies that we bring in the segment of healthcare, it is the trust, the integrity and the conscience of the healthcare provider that will decide if medical field is trusted by the people or still seen in scrutiny by the people. So the future of healthcare depends not just on technology, that is one aspect. Science is one aspect, but on the conscience of the people. The conscience of the healthcare providers, the conscience of the healthcare infrastructure, etc. When compassion and justice guide decisions, medicine becomes truly humane. That is your final conclusion that you can write. So with this, we've come to an end for today's session. If you're taking back anything important, please make sure to like this video. Comment down below. We absolutely love to hear from you. In case you haven't subscribed to our YouTube channel, this is the time to do so. On that note, allow me to sign off. Definitely watch this video if you haven't, because these topics become very important for the examination and the changing nature of the examination especially. Thank you so much. Take care.